Hello, everybody, and good afternoon. Thank you for joining us for Cooperative Health's The Forum. Can you believe we are already past the midway mark for 2020? But just as a recap for July, a couple of highlights to remind you all. Actually, July was when we initiated our Employee Engagement Committee. Very excited to hear some updates from our new committee that represents you, our team members of Cooperative Health. July also marked our second leadership forum, which is extremely successful in pulling together all of our site leadership teams and our mid-level managers. And this was in an effort to improve our communication throughout the cooperative. Some things, though, that have not changed throughout the entire year and that we'll continue to focus on in moving forward are our 4 strategic priority areas: healthcare for patients, workforce development, patient experience, and community development. So August is National Immunization Awareness Month, and Cooperative Health has joined forces with HRSA's efforts to promote Well Child Wednesdays. So for the next 4 weeks, please look out for announcements from Cooperative Health's comms team about hashtag Well Child Wednesdays. August is also National Opioid Prevention Month. So in recognition of National Opioid Awareness Month, let's hear a few words from Dr. Rufus Wofford, Division Director for Behavioral Health Services at Cooperative Health.
So, a friend that I grew up with since middle school, we'll call him Evan, wanted to share a bit about his story. Now, when we grew up together, we were rough and tumble boys. I mean, we would try to do WWF style on the trampoline and everything, playing as friends, got along with his brothers and everything. And we came up, we played sports together. And Evan was one of these guys that, even look at me and say, you're my best friend. And you don't always get that a lot from your male friends. So it was, that depth of relationship. And but as the years progressed, it turned out that Evan eventually came to use opioids in a chronic way, and had a number of attempts at trying to get remission from that, family involvement, and as you can imagine, a lot of pain involved in that, a lot of hardship on the family side, and as other people see their family member going through this, and as friends see someone going through that, of course there's compassion, confusion, wondering what to do. A person, goes to get some help, a lot of hope builds up, but then, if there's a relapse, then it becomes just very difficult on everyone involved. And so we had another friend of ours, Mark, who part of Mark's job was to help people that were dealing with these kinds of issues and be able to get into recovery and maintain recovery. Well, Evan's dad dropped Evan off at Mark's place, and Evan's dad had really had it at this point and just sort of set the bags down and left it at that, wanting Evan to get better, but at the same time not necessarily a whole lot of hope so much as frustration. And Evan was set to go, I believe, the next day into care to be able to get into recovery. And Mark went to work, and when Mark came back home, Evan was dead. And so I was actually asked to eulogize Evan. And that was no small ask, knowing that here was a life that had been taken in the midst of chronic substance use. And So with that, I remember having to deal with my own anger at a lot, my own anger at Evan as well, and really having to work through some grief. At the same time, recognizing that was years ago, and today in South Carolina, there are a lot more options for people looking to get into recovery. It can be that somebody can go and receive services right there in primary care. We refer to that as medication-assisted treatment. And I just think, what if that had been available for Evan, where he wouldn't have to go far away to another town to try to get into a recovery center or program, but right down the street, be able to get services, be able to manage it. And so we call that medication-assisted treatment. And I just think, about folks that are dealing with these issues is that someone's Evan, that's someone's friend, someone's brother, someone's child. And we don't want to add a whole lot of extra stigma around it that used to be there. So with that, when we think about stigma, these are, think about the terms that people often use for those with chronic substance use or chronic opioid use. You can rattle off that list in your own head if you like. I'm not going to dredge it up here. But with that in mind, we really want to think about, chronic conditions as a whole in primary care. You can end up with some folks who, take their medication after surgery and end up with persistent opioid use after that. So, the condition in about the worst way is really non-discriminating. It cuts across social classes, and it touches many lives and many families and many people. So we want to be able to get help where help is needed. We want to be able to save lives. At the same time, we don't want to add a whole lot of stigma around that. So when we think about that, we're thinking about chronic conditions. Just like, you wouldn't be throwing shade on someone who is, taking medication to manage their blood pressure, taking medication to manage their diabetes. We don't want to add any extra, weight and burden of shame on top of somebody who is taking medication, to be able to live a functional life for whatever condition they're faced with, and that includes persistent opioid use. When we think about the opioid epidemic and all the people that are being affected, and we bear in mind our calling to serve in the spirit of the Good Samaritan, we take seriously that charge to go and do likewise. And I don't read anywhere in that passage where the Good Samaritan said, well, let me do a character check first, or I think I'll help you with this wound, but not that wound because of maybe how you got it. It's just a matter of helping where there's a need and going and doing likewise. And so we are able to do that through MAT services or medication-assisted treatment here through Cooperative Health. We are currently offering that, and we'll be expanding our offerings to broader locations within the community. And really, really value the opportunity to serve in this way, to help touch lives, to help change communities. August 20th is considered Opioid Misuse Prevention Day, and you can learn more about behavioral health and primary care, where we'll be offering medication-assisted treatment services through visiting our website, www.cooperativehealth.org.
Many thanks, Dr. Wofford, for sharing your personal story and the importance of the awareness of opioid misuse. Please feel free to reach out to Dr. Wofford or any of his team members for additional information or inquiries. Also for the month of August, it is National Immunization Month. So let's hear a few words from our very own CMO, Dr. Schlueter.
My name is Dr. Eric Schlueter, the Chief Medical Officer at Cooperative Health. I want to thank you for choosing to use Cooperative Health for your healthcare needs. During this time with COVID-19 or coronavirus, we are all concerned about our health. I wanted to speak this moment about those of our young children, those between newborn to 24 months. Our young children are growing and developing at a rapid pace, and we need to keep them safe, and that includes their well child visits and their childhood vaccines. At Cooperative Health, we really are concerned about the health of our children. We have made special accommodations for our children to be able to continue to receive their well child visits and their vaccines in a safe environment. So please, we are open for business, taking care of our children, and please have them come in for their vaccines and their well child visit. Thank you.
Thank you, Dr. Schlueter. We really appreciate those words and the important reminder of well child checkups and immunizations. Cooperative Health team members, don't forget to follow us and like us on Facebook and Twitter, and also be on the lookout for #WellChildWednesdays. Last but not least, everybody, August is National Health Center Week, one of the largest celebrations for all community health centers nationwide. Mark your calendars, Sunday, August 9th through August 14th. But here at Cooperative Health, we begin today, August 7th. So National Health Center Week isn't just a time for us to show our appreciation to the patients who entrust us with their health care, but it's also a time for us to show our appreciation and our gratitude to you all who remain committed to providing services to our patients and to being a beacon of light in our communities. So we have a special message that we have created for you all today. Please stay tuned.
In 1981, Cooperative Health began with a vision
To provide children in Columbia's Eau Claire community with quality,
Affordable and compassionate health care they wouldn't otherwise receive.
Nearly 40 years later, that vision has grown.
into the state's largest federally qualified health center.
serving more than 61,000 patients.
In the 4 Midlands counties.
This amazing progress wouldn't be possible without the selfless dedication and hard work
Of our team members who call Cooperative Health their work home.
Never before has the Cooperative Health family been faced with the challenge that 2020 has presented us.
Even in the face of this unprecedented global pandemic,
We banded together to preserve and continue providing access to exceptional health care in the spirit of the Good Samaritan.
Congratulations to National Health Center Week.
This is your week.
your time to reflect on all that is good.
delight in fellowship,
And celebrate with your colleague.
With gratitude, I want to thank each and every one of you for your contribution in the community. There are many others who would love to thank you for the service that you provide in the community as well. Let's take a moment to hear from them.
Hello, I'm Columbia Mayor Steve Benjamin, and I wanted to take a moment to congratulate Cooperative Health as you celebrate National Health Center Week this year, August 9th through the 15th. In these incredibly challenging times in which we're living, as we face down the pandemic together, it has been a true comfort and a blessing to have our partner of over 38 years, the amazing service providers and staff, providing services to over 60,000 patients across Richland, Lexington, Fairfield, and Newberry counties. You've made the difference. And I want to say thank you. May God continue to bless you, and let's continue working together to help improve the health outcomes for people all across this community. Thank you.
Ladies and gentlemen, good day. I'm Joe Wilson, Member of Congress. Thank you for everyone at the Cooperative Health for all of your important work, especially during these uncertain times. I appreciate your hard work and commitment. Happy National Health Center Week.
Greetings. I am South Carolina State Representative Annie E. McDaniel. As a member of the South Carolina House of Representatives, I'm honored to salute you, Cooperative Health, your leadership, your staff, and your providers for your hard work and dedication during this National Health Centers Week. Thank you for serving the many residents of House District 41, which includes Fairfield and Richland counties. Thank you also for continuing to serve us during this unprecedented COVID-19 pandemic. Having served as a Community Health Center board member and a staffer, I understand your challenges and your successes. Cooperative Health, I wish you the best as you celebrate National Health Centers Week. Thank you.
Happy National Health Center Week. As your senator, please know I am so very proud of our very own Cooperative Health. We've got some of the finest providers and staff anywhere in the state of South Carolina. Thank you so much for your hard work and your dedication, especially during this COVID-19 pandemic. These are some trying times, and you've gone the extra mile for our local communities. As your senator, please know how much I appreciate each and every one of you. Again, happy National Health Center Week.
I am pleased to offer my congratulations to the Eau Claire Cooperative Health Center. Now, for almost 40 years, this center has been serving the people of Eau Claire community, and I'm very pleased that because of this service, you are a federally qualified community health center. That means that the resources that are necessary to get things done in this community can be made available by the federal government. I'm pleased to be representing you in Washington, and I will always do everything I possibly can to make sure that community health centers all over this country get what they deserve. In fact, we've got in legislation now to get 100% coverage for federally qualified community health centers, so that there will be a community health center within commuting distance of every single American. Congratulations, Eau Claire. I'm looking forward to 40 more.
We'd like to know your story and how your site celebrated National Health Center Week, so please make sure you take pictures and send in all of the great stories. You can email them to communications@cooperativehealth.org. All right, everybody, that's a wrap for this segment of Cooperative Health's The Forum. Again, thank you for tuning in. We hope that you enjoyed our presentations today, and be on the lookout for information and updates in the weekly connections that we send out every Friday. We'll see you again in 4 weeks, September 4th, 2020, for the next Cooperative Health, The Forum.